Today, we're going to dive into a pretty incredible medical story. It's all about one patient facing some seriously tough odds, and how a single piece of technology, one scan, completely changed the game for her.
So, let's start with a number, because this number tells you everything you need to know about how rare this situation is. Less than 2%. Think about that. That's how often a colon cancer spreads only to the brain and absolutely nowhere else. It's just exceptionally uncommon.
And because it's so rare, it creates this fascinating medical puzzle, right? Colon cancer itself is, unfortunately, very common, but normally it spreads to other places first, like the liver or the lungs. For it to just leapfrog over those usual suspects and land only in the brain, well, that's almost unheard of. So how on earth do you even start to tackle a case that unlikely?
And this is where the stats just get wild. When colon cancer does spread, it usually follows a pretty predictable playbook. But in this case, we're talking about a total statistical outlier. Not only did the cancer spread to the brain, which itself only happens in a tiny percentage of cases, but it went only to the brain. And that one detail, that little word only, is absolutely critical, because it opens the door to a completely different kind of fight.
Okay, so behind all these statistics and puzzles, there's a real person. This isn't just an interesting problem, it's someone's life on the line. So let's shift gears and talk about her story and how this whole crisis kicked off.
So the patient in this case is a 74-year-old woman, and she's already been through it. She'd battled stage 3C colon cancer, went through the surgery, the chemo, the whole thing. And for 18 months, everything looked good. Then, just out of the blue, she starts having these seizures, but only in her left arm. For her doctors, I mean, you can imagine, the alarm bells are screaming. The first thought in everyone's mind has to be, the cancer is back.
And this is the pivot point in the whole story. This is the moment where technology steps in to give them an answer they just couldn't get any other way. This is where we meet the real hero of this story. The PET/CT scan.
The doctors were facing one massive, critical question. Okay, is the cancer back? Yes or no? And if it is back, is it only in the brain or has it spread everywhere? The answer to that question changes everything. If it's all over, the treatment is about managing, about buying time. But if, and this was a huge if that spot in her brain was the only one, they could actually go for a cure.
So how do you get that definitive answer? Well, with this amazing piece of tech, a PET/CT scanner. The way it works is just brilliant. You get injected with a special kind of radioactive sugar. Now, cancer cells, they are greedy. They're super active, and they just gobble up sugar way faster than your normal healthy cells. So the scanner picks up on these areas that are chugging all the sugar, and on the scan, they just light up like a Christmas tree. It shows doctors exactly where the enemy is hiding.
And here it is. This was the result. The scan lit up like a beacon, showing this one single hotspot in her brain. But here's the incredible part, the part that changed everything. The rest of her body was clear. It was totally clean. This one spot, that's it. This single image gave her doctors the green light they were hoping for. It was time to go on the attack.
Now that they knew for sure they were fighting a single enemy in a single location, not an entire army spread all over, the medical team could launch a full-scale targeted assault. This wasn't about containment anymore. This was about total annihilation. They came at it from 3 different directions. First, neurosurgeons went in and performed what's called a gross total resection, which is basically a fancy way of saying they physically removed every last visible piece of the tumor. Step 2, they brought in the big guns, stereotactic radiosurgery. You can think of it like a radiation sniper rifle. It delivers one single high-powered blast of radiation right to the spot where the tumor was to obliterate any microscopic cancer cells left behind, all while saving the healthy brain around it. And finally, just to be safe, she got a round of chemotherapy, sort of a final systemic cleanup crew to make sure nothing was hiding anywhere else.
And here's the payoff. This is the result of that aggressive, targeted strategy. On the left, you see the before scan with that bright, angry tumor. And on the right, 12 months later, it's just gone. Total resolution, no evidence of disease.
This is the visual proof. This is what's possible when you can get a diagnosis that precise.
So, what's the big takeaway from this one incredible story? Well, it turns out a case like this isn't just a happy ending for one person. It actually helps build a powerful argument for a new way of thinking about these super rare situations.
You know, the authors who wrote up this case study really nailed it. They basically said, look, this case shows that if you find a single spot, you go after it hard. An aggressive, targeted therapy isn't a long shot. It can actually give these patients a chance at prolonged survival, something that just wasn't really on the table before.
So if we boil it all down, the lessons are pretty clear. First, a whole-body PET-CT scan is absolutely vital. It's the only way to know for sure that you're dealing with an isolated recurrence. That knowledge then gives doctors the confidence to go all in with treatments like surgery and that super-focused radiation, the SRS. And we see that combination as a powerhouse. It can lead to long-term, disease-free survival, and maybe just as important, it lets patients avoid whole-brain radiation, which can have really tough cognitive side effects. It's just a smarter, more targeted, and way more effective approach.
You know, this whole case leaves you with a really powerful thought. It started with a patient who, statistically, was facing a pretty grim future. But then, one clear image, one definitive picture from one scan completely rewrote her story. It really makes you wonder, doesn't it? How many other medical mysteries are out there, just waiting to be solved by the right picture?